So good morning, everyone. We're still seeing more and more people coming through, but we'll make a start considering it's a couple of minutes after 10. Firstly, welcome and thank you for joining us for the launch of the Parity edition on Housing First. We had almost 100, I think 99 registrations last time I checked, and I think that is an incredible testament to where we're headed in the homelessness sector around housing first principles. And firstly, I want to acknowledge that this Parity launch is being hosted on Wurundjeri country and pay my respects to elders past and present. I also want to acknowledge the lands that many of you are meeting us on today and their traditional owners. Obviously, it is a week of great sadness across the country in relation to where we landed with the Yes campaign, and we really feel for individual Aboriginal and Torres Strait Islander people and communities right now, and their sadness is felt. And I just want to make the statement on what was and what will always be Aboriginal land, that sovereignty was never ceded. To begin today's proceedings, we're really fortunate to have Juha here, who is the Head of International Affairs at the Y Foundation Finland, to launch the Housing First edition of Parity and speak briefly about Housing First in Finland. Juha has an extensive work history in housing, previously has led the Housing First Development Network in Finland, and the network includes all the key stakeholders regarding homelessness work. Juha has been a frontline support worker, a housing manager, and also the CEO of a Housing First provider. So it is with really great excitement that we welcome Juha to do the official launch of this Parity edition for us.
Hello everybody, my name is Juha Kahila and I work here at the Y Foundation in Helsinki, Finland. It's my absolute pleasure to be launching this Housing First in Theory and Practice edition of the Parity. I think it's important that we know the theory, but we also have the practice in our veins. In Finland, times has changed a lot since we began Housing First in 2008. The original Finnish Housing First model was pioneered by the group of 4 Ys. That's what it's called back in the days. But the Housing First 2.0, which we launched in 2020, was developed with over 30 different organizations from all the levels and with over 50 persons around the sector. There was a deep collaboration between different sectors, and I think that's one of the things why Housing First 2.0 in Finland looks quite good. There are many things that we develop, and I have shared them in this Parity edition, and we have divided those in 6 spearheads, which I will explain in the writing. But I'm glad to say that some of those spearheads are already in developing in the field, and I think the progress looks quite promising, and we have some good results to report in a few years' time. But of course, we are living in challenging times globally. First there was the COVID pandemic, and now we have a war in Europe, or 2 wars, no one knows at this point. But in Finland, we have managed to reduce the number of homeless people despite these challenging factors in our time. It hasn't been easy work, and it has meant that we need to work even harder in the future. Because in Finland as well, there are new challenges that are lying ahead of us. We have a new government at the moment, and they are planning to do some cuts to the social benefit system, also planning to build less, more affordable housing in the future. And of course, those things have been the cornerstones of the Finnish success in the reducing number of homeless people. So as a sector, of course, we are doing everything in our power to doing advocacy work, try to lobby, and try to make it so that at least some of these plans will not happen in Finland. But of course, there's also positive things. So the new government is planning to introduce a plan, national plan, to end long-term homelessness by 2027. And then I also want to highlight the city of Helsinki, which is doing an excellent job at the moment. And they have really ambitious goal to end homelessness by the end of 2025 from the city of Helsinki. It's a really ambitious goal, but they have a great program to do it, and I'm sure it's totally reachable. And I think it would be great to have a Scandinavian capital with no homeless people at all. So, I hope you will have a nice webinar. Enjoy the lunch of this great edition of the Parity. And remember, Housing First and Ending Homelessness has a momentum at the moment. Many politicians and decision makers are keen to talk about it, to discuss about it, and to hear more about it. But it is our responsibility that these words, discussions, will also turn into action. Because at the end of the day, action is the only thing that matters when it comes to ending homelessness. Thank you and enjoy your day.
Thank you very much. And we've been really lucky. I think this edition has us have more international speakers than any other one, which I think is really a great credit to Housing First and what is going on with our international friends. But today, actually, we also have some of our local speakers, and I'm going to introduce both of them just to save time, and then they will present consecutively. So our first speaker is Christian Roggenbuck, and he's currently working as a Senior Policy Officer for the Office for Suburban Development. He's focusing on creating more livable cities, and for those of you who have been following local government, you will see that that is a really big focus across local governments in the country. And he's addressing socioeconomic disadvantage. Working for the Australian Housing and Urban Research Institute, Christian has published several reports on issues relating to housing and homelessness. This includes a report on Housing First, which is what today's talk is based on. So, Christian, we really thank you, and we recommend to people who are watching today that you read his article in Parity, which also highlights some of the key issues that he'll discuss today. Over to you, Christian. Thanks.
Fantastic. Thank you very much, Deb, for the introduction, and I'm really excited to present today's at the launch of this edition, and it's fantastic having so many international speakers present as well, because it really shows that Housing First has become such a widely adopted approach, and it has really gotten the attention of policy makers and decision makers. So it's a great opportunity there. I'll just start sharing my screen and hope that's possible for everybody to see. Fantastic. So today's webinar is really on Housing First, and as Deb mentioned, it's drawing on a report I published last year for the Australian Housing and Urban Research Institute, which was looking into the effectiveness of Housing First, doing a review of the evidence, what we know in Australia, as well as internationally, on the outcomes people in Housing First have experienced, as well as issues around implementation, what are enablers and barriers, as well as which different housing forms support Housing First, and having a set of recommendations. In today's webinar, I'll provide a brief introduction of the key principles underlying Housing First to set the scene, as well as argue that Housing First programs need to be embedded within the broader housing system. So, to kick off, 1 second. Yeah, okay. Takes a little bit with the slides to move on. So, Housing First is a service response that supports people who have experienced chronic homelessness, and it originated with supporting people with mental ill health, especially, and other complex needs. And I think that's really important to keep in mind. And it originated in the US, in New York, in the early 1990s with a program called Pathways to Housing by Sam Zenveris, who did a fair bit of evaluations of the program and really was able to demonstrate the success of this program, especially in contrast to prevalent continuum or staircase approaches, which really required people to show that they're housing ready before getting long-term housed, and often would be stuck on a specific staircase essentially, and not being able to move into long-term housing and address actually the supports they would need or be able to really go out to that journey of recovery and be stuck in an institutional setting. Since the early 1990s, Housing First has been widely adopted, and I think, as this Parity edition shows, it has been adopted worldwide, like originating in the US, and there have been a fair bit of studies in the US and Canada showing the evidence, but as well Europe, and as you were saying before, like Finland is a really good example of how Housing First has been implemented in a broader housing system, as well as becoming more influential in Australia. And we've seen a lot of programs being labeled Housing First and coming up here. The success of Housing First, I would argue, comes by its evidence, first of all, that is shown to be effective, but as well being based on a philosophy of housing as a human right. And there's a reason why Housing First has become so widely adopted, and I think it's because the message in some way is so simple, and in some way that has meant it has become widely adopted and hasn't just stayed a model which is effective, but it's too complex to understand or doesn't catch on. At the same time, there's a bit of a danger challenge in that as well, that often it is seen as this kind of like overarching philosophy, but not actually implemented with all the principles attached to it, which make it a success factor. So I think that is something I would want to talk about a little bit more in this presentation as well, with issues of fidelity, and highlight that individual Housing First programs really need to be embedded within the bigger housing system to be effective. So, what is Housing First? And I'm sure a lot of you are working in this space and are familiar with Housing First. But to really briefly reiterate, it is built on a set of key principles. One of them is that people have immediate access to permanent housing, so they don't have to transition from one short-term accommodation to the next one to be able to at one point secure long-term housing, but they receive permanent housing immediately without needing to demonstrate that they are housing ready. And as well, a key principle is that housing and support services are provided by separate organizations, so that if you may lose your support services or you might lose your housing, you don't get disconnected from further supports you've got. So that there's a bit of independence from these two sides. And another key issue with people being supported who have quite high and complex needs is that they've got access to intensive and flexible supports. But what is really crucial to that is that they've got choice of which supports they received and their treatment. So even though it might be quite intensive supports, it's at the right time people feel ready to engage in these supports. Beyond housing and support, there's a fair bit of work going into helping people sustain their tenancy and a broader goal of working towards recovery and reintegration into the community. So those are a lot of principles set out in the initial Pathways to Housing program, and they've been adopted worldwide. And one example would be the Housing First Principles for Australia by Homelessness Australia, published a couple of years ago, which build on these principles and have adopted them to fit into the Australian welfare system, which differs to the welfare system in the US. So yeah, definitely worthwhile looking into those. So how effective has Housing First been? And from the evidence base, it's clear there's a lot of information out there. There have been really high quality studies over multiple years coming out of Canada, US, but there's a lot of evidence worldwide. And a lot of these studies have focused on housing outcomes. And it really demonstrates that Housing First is highly effective in providing housing stability. In most cases, that is measured around housing retention rates, meaning how many people actually are able to sustain their tenancy. That is often measured in under like a 12 to 24 months period. And in most cases, programs show tenancy sustainment rates are between 80 and 90%. Some are a little bit higher, and it really depends on obviously the cohort people are engaging with. And the studies which had lower rates of housing retention showed that people had often quite complex needs and in relation to alcohol abuse and other substance abuse. So it doesn't work for everybody always, but in comparison to treatment as usual approaches, this is a really high housing retention rates. And obviously, there are fewer studies which have like a long-term evaluation of Housing First, but over the years, there have been a couple of publications having followed the pathways of people over like 5 to 6 years, so quite a long-term period. And those indications shows that people are able to stay stably housed. So housing outcomes, very, very clear evidence. With non-housing outcomes, the evidence is a little bit less clear as such. It does provide people with access to services and with a whole range of non-housing outcomes, and that relates to like access to health, mental health, and other support services especially. And studies have demonstrated reduced rates of hospitalization and less involvement with the justice system, as well as less need for crisis accommodation and a whole range of other responsive acute services. People as well have shown that they've got improved quality of life, which is often like self-reported. And for some people, it has meant that they've been able to re-establish social connections. However, I don't think one can see Housing First as a panacea where it just solves people's issues and problems, because these people have experienced long-term homelessness and all the trauma, substance use, and a whole range of other issues which may have built up over time. So I don't think it would be fair to expect a program to solve all of those issues immediately. I think it should be noted that a whole range of non-housing outcomes typically take a long time to eventuate. So within a 1 or 2 year time frame, that is not necessarily the case. So moving on to cost effectiveness, which is often a measure looking into if Housing First programs should be funded or not funded. And the evidence has become clear that it is cost effective to support people experiencing homelessness, and there have been a whole range of different evaluations in the Australian as well as international context which have monetized this cost effectiveness. So definitely worthwhile looking into that as well. And the cost effectiveness is achieved by cost offsets by people using less acute and emergency services. So not needing to go to hospital, being able to access health services before they become acute, and in general being less involved with the justice system. But it should be noted that Housing First, having intensive and flexible support, is a resource and cost-intensive intervention, and which is most cost-effective for people with high and complex needs, but less so for people with maybe not moderate needs, if one can say that in that way. And I think that is a point I would like to make later in the presentation, that housing first as such is, to a certain degree, can be seen as a failure in the system of preventing homelessness to occur in the first place, or providing early intervention as such, and is a response to people having experienced chronic homelessness. And in that case, it is cost effective, but it would be a lot more cost effective for people not to get into that place in the first instance. Looking into broader housing and homelessness outcomes, I think there's a big argument to make that evaluating housing first and assessing if housing first should be provided at all is that it's not just a financial objective, but an ethical decision to actually support people, and having a program in place which actually puts people on a path of recovery and not lets them just cycle through the short-term crisis-driven system and without being on the pathway to recovery. And so looking into the social benefits of people having access to housing and support, obviously that has not been so much evaluated and monetized. And so the evidence is less clear on these issues, but I do think one has to also consider the longer term impacts, such as reducing intergenerational trauma and poverty. As mentioned earlier, a big question is around the fidelity of implementation. So in how far programs fit into those principles and set out through the initial pathways to housing and their adoptions across the globe. And there are a whole range of common modifications which may limit its efficacy. I think that's important to keep in mind if you roll out a housing first program, but don't adhere to all of the principles. You should not expect to achieve the same housing outcomes and non-housing outcomes. And a couple of common modifications include delays in finding long-term appropriate housing and requiring people to move from one transitional housing to another transitional housing and for a long-term period of time, and maybe only then providing permanent housing. And that point becomes especially important that a lot of housing first programs, being quite cost intensive, are only provided in a certain time amount. If that's 1 year or 2 years, the housing is provided, as well as especially intensive support services. And after those 2 years, maybe support services are cut to a bare minimum, or housing is not further provided, or people are expected to graduate to be independently housed in social housing. And that really might impact the efficiency of housing first programs, because it might mean that people don't have a permanent home, as well as that recovery can be a long-term process which might take longer than a year or 2 years. As well as in some instances, housing and support are provided by the same provider and not independently provided. So somebody's housing manager as well as a case manager might be people working for the same organization and not having that independence. This isn't necessarily a problem, but I do think it is something to keep in mind, and how that impacts people's recovery process. Having that said, housing first, coming out of the US, would need to be adapted to different welfare and social systems, as well as being culturally appropriate, as well as addressing the needs of the cohort a specific program would like to support. So potential adaptations include like collaborating with street outreach teams, so you have a building trust and relationships before people are housed, as well as providing support services beyond core needs. And that could be support services like art therapy and a whole range of other support services beyond health and mental health. And another really key one is culturally appropriate support services. And just posted another report from Nungamir Myanmar, which is a WA provider supporting Aboriginal people and communities and having developed housing first principles for Noongar people. And I think that is an interesting document to look into to see how housing first is adopted in a culturally appropriate way. And another adaptation might be focusing on issues specific to the target cohort. So maybe addressing the needs of younger people, which we see, for example, through youth fires. Having all of that said, there's the need to strike a balance between adapting a program as well as ensuring that those modifications really don't affect its effectiveness. So it is something to be aware of. What are barriers and enablers to implementation? A couple of key ones are around the capacity of housing providers as well as support providers to deliver housing first, and understanding the frameworks and the principles underlying it, because it is a different framework to business as usual approaches, and having that understanding is crucial to it. And having independence between support services and the housing providers means you still need to establish effective partnerships, coordinating the different people, as well as forming a project leadership to really develop a shared vision between stakeholders. And that can be stakeholders outside of the direct service and housing provision, but that can be developing a shared vision with local council, for example. And overall, as well as enablers, providing support services that are recovery-oriented, person-centered, and importantly, adequately resourced. And linking back to the previous point around assessing program fidelity to housing first principles, and if required and appropriate, intentionally tailor the program to suit the needs of the target cohort. And another really important point is to build an evaluation from the onset to understand which modifications are needed, what hasn't worked, which are learnings, and how to really adopt it and modify housing first to the target cohort. And then a whole range of barriers exist as well, which really impact implementation. And one of the most common one is really that constrained access to secure and affordable housing. So the difficulty of housing people immediately, as well as the issue of long-term housing as such, being able to secure that, which often becomes a problem if housing first programs are funded for a certain amount of time. The same applies for support services, which have resourcing and funding constraints to maintain ongoing support. And a limited integration of housing and support services. And that's again where these effective partnerships come in. So I'm not going into these issues in too much detail in this presentation. However, I do think they're a key point to see that housing first programs have to be embedded within a broader housing system. And that is a key point I would like to make in this presentation, that homelessness is caused by so many factors which relate to housing as well as non-housing factors. And as we heard in the initial presentation, even political changes might impact that drastically, and it can't be effectively addressed by standalone housing programs. So in the inner circle in this diagram, we've got housing first programs which really have been trying to be effective to reduce chronic homelessness and provide immediate access to housing integrated with intensive wraparound services. But I would argue that because they're so cost and resource intensive, we actually should see them in a broader housing and homeless system where there's almost a layer preventing people to become chronic homeless beforehand, where we've got services which provide early intervention and prevention of homelessness. So it is really around that access to required support services and social housing. So having access to social housing where maybe there are not further complex needs and no need for all of the intensive wraparound services provided in Housing First programs. And beyond that, really in a further layer, the provision of stable housing, and that is around the availability of affordable, appropriate, safe and secure housing within an adequate welfare system. So that can go from income supports to employment opportunities where people are able to stay stably housed without then putting pressure on the social housing system and other support systems and not having that downward spiral for maybe out of quite simple reasons all the way down to, or easily fix issues, all the way down to where people then are required to be supported through Housing First programs, which are quite cost intensive. And I would argue that this entire housing system could be supported by Housing First principles, and not only Housing First programs, but this issue around these principles of rapid access to housing without proving housing readiness, permanent housing, as well as access to intensive, as well as flexible supports whenever needed, I think would be something guiding essentially anybody, as well as the other Housing First principles around consumer choice, separation of housing and support, recovery-oriented support, and community integration. So to wrap it up, and I only had a short time to present today, I think it's quite clear that Housing First programs are effective in supporting people who have experienced homelessness, especially to remain safely housed and to gain access to support services. And they are cost effective to support people experiencing chronic homelessness. However, fidelity Housing First principles is important to ensure that desired outcomes are achieved and not present by kind of like cutting a couple of these key principles and expecting the same outcomes, but keeping in mind that a balance needs to be struck to suit local conditions. But, and I think that's an important one, that Housing First programs need to be integrated within the broader housing in the homelessness system, because essentially it is a lot more cost effective and better for people not to become chronic homeless in the first place. And fundamentally, this requires addressing the multiple housing and non-housing factors contributing to homelessness and housing insecurity. Thank you. I'll stop sharing my screen now.
Thank you so much for that, Christian. I particularly love that element where everyone, particularly in government, want to talk about the savings, which we all know that it's the financially right thing to do, but I really like your focus on the ethical obligations as well. And that's certainly been the point of view that CHP has been bringing up as the peak for a number of years now. And I also really like the fact that you talk about the fidelity, because we have lots of people who say, well, we're already adopting Housing First. So we always say, well, actually the fidelity to the principles. And I really like your focus on the target cohorts around different groups of people need a specific response. And I think that's a really good issue that you highlighted. So thank you very much, Christian, and enjoyed reading your article in Observatory, which was there for others to look at as well. Now, this brings us to our second presenter, Charlotte Georgiou, who we're very, very lucky to have her today. And I meant to say that we also have got a chat, so that if you want to ask any questions of Christian, just pop it in the chat and we'll bring those up as questions to our presenters. So Charlotte is the team leader of the Women's Supportive Housing Team at Sacred Heart Mission and an active member of the National Housing First Trainers Community of Practice. Earlier this year, Charlotte attended a Europe Hub Housing First Train the Trainer session in Belgium, and at Council to Homeless Persons, we're always saying that Train the Trainer is absolutely essential for us to embed housing first principles across the jurisdiction. So without me continuing to talk about how fabulous Charlotte is, I'll just hand over to her to give us her presentation. Thanks, Charlotte.
Thanks, Deborah. Good morning, everybody. As mentioned, my name is Charlotte and I work as the team leader at Women's Supportive Housing Team at Sacred Heart Mission in St Kilda, Melbourne. I've been asked to speak today in connection to the article I was a part of within this edition titled Housing First Training in Australia, the Principles, the Project and the Practitioners, alongside my fellow trainers Hayley, Rosie, Sarah and Leah, and on behalf of the National Housing First Trainers in Australia. In this piece, we were hoping to express where the National Housing First Trainers started, where we are now, and where we plan to go, as well as history on the principles and the broader project. And our piece in this edition of Parity outlines the connection between the Housing First Europe Hub's Train the Trainer program and the Australian version. So who are the National Housing First Trainers? We are a group or a community of practice of advanced homelessness practitioners who have completed the Australian Housing First Train the Trainer program. There have been 3 intakes in this program so far, and each cohort have completed 6 training days across 6 weeks, with 38 advanced homelessness practitioners now having graduated since its inception in 2021, which we're very excited about. These practitioners have been from Victoria, New South Wales, Queensland, South Australia, Tasmania and Western Australia, and we are hopeful to welcome practitioners from Australian Capital Territory and Northern Territory in the future. Recruitment to the Train the Trainer program is a competitive process, with potential applicants completing an application and interview with endorsement from their organisation and organisation CEO. This supports practitioners to maintain their connection with the community of practice after graduating and supports the practitioner's commitment to move on to providing training on housing first themselves. Graduates from this program have rolled out in-person and online training to a variety of audiences over the last 3 years, including to practitioners, program managers, and beyond. In 2022, an example of one of the trainers' shared projects was that the group came together to roll out a national webinar series that explored the Australian Housing First principles in detail, with the aim to support attendees to increase their understanding of the principles themselves and then exploring the practice, including potential implementation challenges and opportunities. This webinar series is available on the Council to Homeless Persons YouTube page and includes 8 videos that were released over 8 weeks, starting from National Homelessness Week. This year, we had 12 advanced homelessness practitioners complete the 3rd round of the Australian Housing First Train the Trainer program, and I was privileged to be one of the 3 co-facilitators of this round. The program incorporates pre-reading or homework that includes fantastic resources on the evidence base of Housing First and its application locally and internationally. After each week, the co-facilitators collate and distribute post-session resources, and these continue to be available to the participants after they graduate to contribute to their resource pool for future trainings that they provide. The group's connection to international Housing First approaches continues, and we are fortunate to have had international guests to our community of practice, such as speakers from Finland who have answered questions directly with the group in a video meeting, and an upcoming online Housing First for Youth training with one of the experts in this field from Canada. We've also been incredibly privileged to have speakers from Council to Homeless Persons Peer Education Support Program and from speakers outlining the Noongar Housing First principles and cultural framework. Working alongside and learning from people with lived and living experience and highlighting program design that promotes cultural safety led by First Nations communities are critical in professional development within this space. The community of practice meets regularly and discuss approaches to contributing to capacity building in the area of Housing First within each of our local communities and nationally, with reflections on the implementation of Housing First at practice, model, and systems levels. Sharing of examples of change towards Housing First from the trainers' local communities with the broader group of trainers means the capacity for inspiration and cross-pollination of ideas and collective drive to end homelessness is shared across many corners of this vast country amongst this group. The group will be coming together this February in person for a masterclass with an international trainer connected through the Housing First Europe Hub, which will further the group's capacity to deliver high quality and up-to-date training on Housing First. What we find through delivery of training on Housing First is that for many in this sector in Australia, Housing First has become a common term. The principles are known and looked to as evidence-based best practice approaches. However, we also know that the term is sometimes inaccurately used or placed alongside approaches or projects that don't align with many of the principles or meet a high fidelity. To this point, the Housing First trainers are interested in supporting the development of Australian fidelity models to hopefully provide clarity and direction in policy, program design, and practice. And there are still many practitioners, particularly those newer to the sector, who are not familiar with Housing First, or who have heard the term with some or limited understanding of what the term is referring to. Whether practitioners work within Housing First funded programs or they don't, we hope that practitioners leave training with ideas and tangible ways to embed as many of the principles in their current practice as possible. Whether that's promoting social and community inclusion, creating opportunities for active engagement without coercion, or supporting recovery-oriented practice, just to name a few. What we hear is that learning about Housing First has been like a light bulb moment for many, a puzzle piece that's falling into place. It has affirmed so much practice and approaches to this work that many have hoped are best practice and are now outlined in front of them within evidence-based work, with impressive housing retention rate examples and other outcomes across the globe. In delivering training and sharing information on Housing First with practitioners within the sector, I often hear that people wish they had heard the details of Housing First sooner, and that the language around the principles helps place so much for workers in regards to where theory meets practice. Hopefully, with the continued work of the National Housing First trainers, more practitioners and those entering the sector will learn about the detail and application potential of these principles in practice sooner. And ultimately, hopefully, as our systems and policies continue to evolve, those who access services will have their right to housing realised sooner, with more choice and increased suitability, with the offer of support that is holistic, flexible, person-centred, and accessible. Practitioners are not the only audience that the Australian Housing First trainers reach, as the training is adaptable and applicable to many corners of this sector and the broader system. Change can come from many places, and today I'm particularly hopeful that this includes from trainings on Housing First, from webinar launches and Parity articles. So thank you for your time today, and I look forward to reading this edition cover to cover.
Thanks so much, Charlotte. And any questions, once again, just put it through the chat. I haven't had any questions yet through the chat, which means that people are obviously very clear on the presentations, which is good. So for all our listeners and people participating, you know this as well as I do, that in terms of the Housing First principles and where they were embedded, It all really started in overseas jurisdictions. And at CHP, we have great pleasure in looking at best practice in any international jurisdiction to ensure that what we're providing across the country is the best that it can be. So today we're fortunate to have 3 international perspectives on Housing First and 3 credentialed international presenters. Please note that all our international presenters today have in fact provided an article in the Parity edition, and when you're interested in what they have to say, I really do encourage you to go and read their article as well. So I have been told by the experts that it's going to be better for me to introduce all 3 and then you can have them consecutively present. So I will do that, and then once again, please use the chat for any questions. So our first international presenter will be Stephen Gaetz. He's the Professor and York Research Chair in the Homelessness and Research Impact Unit. He's the President of the Canadian Observatory on Homelessness, which is also known as the Homelessness Hub. And he's the Research Director making the Shift Youth Homelessness Social Innovation Hub. And his Faculty of Education is at York University. Our second presenter is Mark Jordan, who is the Head of Housing First Southwest Region, Rapid Rehousing and Tenancy Support Services in Ireland. And our third presenter is Alex Osmond from Housing First and Lived Experiencing Manager. And we are going to now show you the 3 recordings from our international experts, and I'll hand over to you, Andrew and Simon, to make that magic happen.
Hello, my name is Stephen Gaetz. I'm a professor at York University in Toronto, and I'm going to do a presentation today on Housing First and its impact in Canada. So if you bear with me, I'm going to share my screen here. And so the key thing that I want to highlight are some of the key contributions Canada has made to the international movement on Housing First. So we'll start with a basic intro to how it first came to Canada. So the Pathways to Housing model, Housing First, was invented by Samson Barris, who comes from Canada. He was raised in the city of Montreal, but did his important work in New York. The first Housing First like program in Canada was called Streets to Homes, but it didn't really bear a lot, and still doesn't bear a lot of fidelity to the Housing First model. In the province of Alberta, which is Canada's Texas, it was around 2008 where all the major cities in that province started to adopt Housing First, and that created a big change. But the biggest contribution, I think, or the biggest thing to note is the At-Home Chiswell Research Project, which was a huge research project that the government of Canada invested in to see if it works. And so this research project is the largest project that's ever been done on Housing First anywhere in the world, and has had a huge impact, not just in Canada, but in other countries, because of the amount of research that was published. It's over 140 peer-reviewed articles, a number of reports, and they continue to still publish from this. Now, this grant by the government of Canada was quite large because they wanted to do a randomized controlled trial and follow people for several years. There were 5 major Canadian cities that were picked, and each one had a different thematic area that they were focusing on. The project concluded in around 2013, and the results were quite compelling. The main thing that was demonstrated here is that it works, okay? Follow the recipe and it will work. The idea behind Housing First is great, which is that people should be housed before we put any kind of expectations on them to recover, because the experience of homelessness is what's making it difficult. 70 to 90%, depending on the research project, of people who receive Housing First are still housed after a year. And it's estimated that the at-home Shuswap project ended more than 6,000 person years of chronic homelessness. Now, the results were quite incredible. I won't read through all of this, but you can have a look. Big differences in a number of areas. Some areas it was difficult to see transformations when you compare the Housing First to treatment as usual. For instance, dealing with substance use disorders and some areas around social inclusion. So a question that gets in the way of good interventions in homelessness is people say, can we afford this? And, you know, the argument is, yes, don't let anyone say you can't. It's in fact cheaper to, you know, pay for somebody through Housing First, give them housing, give them the supports they need, than to leave them in a state of homelessness. A key piece of research in Canada by an economist named Eric Latimer looked at the 5 Housing First for you or Housing First cities in Canada and calculated what is the cost of public systems annually to keep someone in a state of homelessness. So that's not just the homelessness sector and shelters and that kind of thing, but it's cost to public health systems, the cost to the criminal justice system. And, you know, because if you're homeless, you're more likely to experience engagement with police. And we all know that a bed in a prison is the most expensive housing program there is. And what he found is that in cities, it costs a lot of money. In Toronto, it's almost $59,000 annually per homeless person to keep them homeless. With that money, you can pay for the rent supplements. You could slap a couple of social workers on somebody's back. They will recover and it will be cheaper. So this study had a huge policy impact in Canada, and in 2013, the government of Canada renewed its homelessness strategy and mandated that the largest communities spend 65% of their federal dollars on Housing First, which led to a massive expansion and taking to scale of Housing First in Canada. So that's important. The second thing I want to talk about, the second key impact, is around Housing First for Youth. This is an important innovation that's based on the recognition from the Housing First research, including at-home Shuswap, that young people don't do as well in Housing First programs because they're designed to meet the needs of adults. What we really need is an approach to Housing First that takes account of the important needs of developing adolescents and young adults. And so that's what we did. We worked to create a new program model, working with youth homelessness sector, working with young people with lived experience, and came up with this Housing First for Youth model. And it's a fabulous model that has core principles that are really based around the need, what any young person should have and should receive. It takes a positive youth development focus, so it's not about what's wrong with the young person, it's about how do we strengthen them. The models of accommodation are slightly different than for adults, including transitional housing, but also the possibility of returning home, because it's been argued by some in Canada that the largest provider of social housing for youth or social housing for young people is the family. The range of supports are built around what does any teenager or young adult need. They need housing supports, focus on health and well-being. They need access to income and education, complementary supports like life skills, and social inclusion. And so the key learnings from the work that we've been doing ever since this all took, we launched the report in 2014, so it's almost 10 years old. But we've concluded a number of things. You know, the case management sizes, the caseloads that is, have to be quite low, like between 7 and 10 youth, if you want the good supports to really take place. Things like graduation. We don't put time limits on how long someone can stay in a Housing First for Youth program, but generally youth kind of pull themselves out of it when they're ready to move on. And usually it's no more than 2.5 years. Okay, we've been doing research on Housing First for Youth, and I'm going to talk about this for a little bit here. We have a big project called Making the Shift. Youth Homelessness Social Innovation Lab, and we're testing through demonstration projects a number of interventions, including Housing First for Youth. And in doing that, we fund the community organizations to operate the project, and then we do rigorous evaluation in terms of outcomes, but also developmental. And so we have 3 different models of Housing First for Youth we're working with here and doing the research on. One is for youth who are currently homeless. The second one is for youth leaving care. And the third is an Indigenous-led approach. And we did a randomized control trial, and with one group getting Housing First for Youth and the other getting treatment as usual, which may include housing-led programs being involved in that, and are tracking them for 48 months. Then we have some preliminary results that show, compared to the treatment as usual group, the group that receives Housing First for Youth supports has much stronger housing stability and shows greater gains in areas like well-being, resilience, etc. So the evidence, which will appear in an upcoming Parity edition, is quite compelling already. We're also doing a research project this fall that's trying to understand how to take things to scale. So we're looking at Housing First for Youth programs in Canada and across Europe, to find out the origin story. What is it about the local context that both facilitates its implementation, but can also make it difficult? And we're looking at a number of programs in Canada. We know of 12 Housing First for Youth programs. Now, the interesting thing is Housing First for Youth took off, even though it was made in Canada, took off much faster in Europe. And so there's 24 different programs across Europe. We're going to be studying all of them. And so Housing First for Youth is an effective intervention. It's one you really need to consider in Australia as a core part of your other excellent work with youth, things like the Upstream Project. So thank you very much. I guess I can accept questions through email, and so we'll work on that. Thank you very much, and that is my presentation.
Hello, Mark Jordan here, Head of Housing First, South-West region, that's Cork and Kerry in the Republic of Ireland. Just a little background, yeah, I've been working in home services for approximately 20 years, 21 to be exact, and my role in the South-West region is Head of Housing First and Head of Rapid Food Housing and Tenancy Support. I also lecture part-time with University College Cork in youth and community work. So just to give you a background of the Irish context, we would have started the Cork Simon Housing First back 10 years ago, 2013, really. That's without the adequate stakeholders involved, really following the principles and practices of the Pathways model. And I suppose identifying those with the highest acuity in the context of complex needs, multiple needs exclusions, dual diagnosis, addiction, mental health concerns, and trauma, adverse childhood experiences in particular. But we ran that and quite successful in housing people and retention rates, but obviously without the adequate clinical support. In 2018, Georgiou, along with the stakeholders, the government, the local authorities, and the health services executive, Georgiou being a philanthropic organisation, funded really the pilot project in 2018 to 2021, and that was very successful. And the new national implementation plan was implemented in 2022 to 2026, so that's ongoing. And with all stakeholders involved, the NGOs in this context in the South-West region of Ireland, it's Cork Simon community and Focus Ireland, along with our partners at the local authorities in Cork City, Cork County, and County Kerry, and our HSC, which is the Health Service Executive Partners, and the clinical side, the health side. So it's been quite successful, I suppose, in theory and practice, of course, our bring different challenges to us all the time, and obviously to be fair, different solutions and antidotes to achieve creation in that context. But it's running to date quite successfully in all regions. I suppose its mechanisms consist of monitoring reviews, targets set, quarterly monitoring reviews, which we have at Wednesday, and it's target driven. And I suppose the properties come from different sources. We might discuss that all the time, but predominantly through we have CAS funding, which is Capital Assistance Scheme, through the European Social Fund, where we predominantly identify properties to buy or upgrade as opposed to rentals, and so we also pursue through approved housing bodies. That's homeless urban approved housing bodies and the open market. So the prioritization is really, really important in the context of the fidelity of the pathways model, identifying those with the longest histories of homelessness, rough sleeping, and some of the multiple needs exclusions we identified there. How it's done in the Southwest region is really via the Venn diagram, which you'd be familiar with in terms of its 3 tenants, and in the context for the selection for Housing First, we look at the most frequent attendees at emergency departments or hospitals in the area, be it emergency, be it mental health, acute episodes, and be it physical health issues. They're collated with on our PASS system, which is a PASS accommodation and support services, a pathways model, which is used by all homeless services in the region and all local authorities. So that's collating information there, combined with the frequent attendees and our local Indigenous knowledge of our outreach teams, our shelters in the area, homeless shelters, and with the local teams in terms of our psychiatry services and addiction services. So all those 3 areas are collated together, and those are really the 3 tenants, or those that are prioritized first, pending the type of properties we have. I suppose in the context of prioritization, within that we have really complex needs in the context. There was a study that we undertook with Simon a few years back in the context of adverse childhood experiences, and be aware of the metric that's used to measure adverse childhood experiences. And the traditional, assessment is that 4 out of the 10 items in the metric, which include physical, sexual abuse, neglect, emotional neglect, living in a household that's domestic violence is ongoing, most predominantly with the mother, living with someone in the family with severe mental health issues, or someone in the family with criminality involved with a judicial or policing contraventions, really. And out of that, out of the study we had of 50 participants in that cohort, 77% had 4 or more of those metrics. And in fact, it was 5.5. And so it just gives you an insight into some of the complexities involved. And obviously that cohort of those vulnerable adults predominantly are the people that we're housing in Housing First in the Southwest region. So the background is there in the context of the adherence to the pathways model in particular. And I know you're all familiar with the principles and practices and philosophy of the pathways model. So the prioritization is I suppose, the genesis of it for us in that context. Obviously, procuring properties, and with the integration of the teams is significant to say the least. We're looking in terms of the context of some of the facilities and resources that we have in the Southwest region, in the context of our support from the clinical side, the health service executive side. One of the things we have about clinical psychology, occupational therapists, clinical nurse managers, obviously coexisting with our case managers and the property team as well. So that's inclusive of the assertive community treatment model in particular. And it's funny, and we're going here, we have just added a mental health social work as well. There is a monitoring review in the context of health needs assessments, and that monitoring review has identified through the service participants research, which is undertaken in the first month of new tenants, and then every 6 months following that, really identifies their needs, the gaps, the issues that are involved. Evaluations are a significant element of the program and its fidelity, of course, and its success. So it's that combination and that right people is integral to the success of the first research. And it's evolving, it's developing, and challenges are part of why we're here. And with these challenges, we have the opportunity to procure solutions. It is a very challenging role for my colleagues. I've no doubts about it. But significant in supporting them in all of that is continued professional development and reflective practice. Luckily, and rightfully so, in the context of clinical psychologists and the implementation of psychologically trauma-informed part, that is obviously significant for service participants or tenants who have experienced high levels of adverse childhood experiences in particular, combined with homelessness makes you sick, but under periods of long-term rough sleeping and stays in emergency hostels. So as we go, that in the context gives you, I suppose, the profiles, the demographics of some of our tenants. What's critically important going forward as well is the inclusion of peer specialist support workers. We are still at the genesis stage of implementing this, and it's vitally important. We have had research for the last year with service participants, with tenants, with people with lived experience of mental health, addiction, homelessness, and their involvement in developing a toolkit for housing first. That's going to be launched shortly, and look forward to that, and happily share the outcomes of that with your yourselves. So in the context, I know I've limited time, so in the history we all know, and the fidelity and principles of housing first. Each geographical area, even within Ireland, brings up its own uniqueness and bespoke approaches to it as well, but fidelity is important to the core principles. Prioritization, that is really significant in determining that the most vulnerable are housed via housing first, and retention rates are quite high in the southwest region. It's over 90%. But the average, I think, nationally would be about 86% in Ireland of retention rates in social integration, which are the areas we really focus through. This has been assisted in particular by the peer specialist involvement, albeit that hasn't been launched yet. The toolkit, we have included recovery coaches, people with lived experience on our teams as well, and obviously the health monitoring tool and its elucidation of key findings are critically important to developing our approach, our staffing, our resources, and the quality of support we provide, including, which is pivotal to the success, peer insight, knowledge, and lived experience. There's many areas we'd like to discuss further. There's some of the topics on that article with Parity, and again, I'd like to thank you for inviting me today, and I know it's going to be a very successful conference, and very, very productive. So hopefully there's enough time that we can join you either online or in person, who knows, to develop more some of those topics. But key to it as well is the funding model, which will be different in course in all jurisdictions. There's some elements there that would be very helpful to you. Staff composition, essential core training, the peer specialist approach, and clinical governance, to name a few. So I might leave it there at the moment. I'm not sure if I've overrun my time, but I'm quite happy to share any of my research resources with Noel and pass them on to yourselves. and what's happening, particularly in the Irish context. Thank you very much. Best of luck, and I hope to hear you soon. Thank you.
Hi, folks. Great to be invited to speak to you guys, covering the article I recently wrote for Parity magazine. I'll be talking a bit about Housing First in Wales and the accreditation process that I covered in the magazine itself. My name's Alex Osmond, and I'm the Housing First and Lived Experience Manager at Cymorth Cymru. So a bit more about myself. I've worked at this organisation on Housing First specifically since 2019. I did some research and policy work for a homelessness support provider in Wales before that. I have had experience of some of the various things that are often associated with homelessness. I won't say much more than that. But in a past life, what seems like a very long time ago, I taught academic writing in higher education. In terms of the organisation I work for, sorry, I'm just having to move my face around as I go through the slides. Cymorth means support. Cymru, perhaps a bit more well-known, means Wales. We're a membership organisation representing over 80 providers of homelessness and housing support services in Wales, local authorities and councils, social landlords, as well as the kind of third sector organisations. And our Housing First work involves us working very closely with Welsh Government to develop the model in Wales, share good practice, but also run the accreditation process, which I'll talk about a bit more in a second. This presentation, I'll very briefly cover the slightly amended set of principles we use here. I'll talk more about the accreditation process, highlighting some key things and points we had to consider, as well as kind of where we're going next. Just to give you a bit more context about Wales, for those who don't know. So this is Europe, compared size-wise to Australia. Obviously, you've got the UK up here in the top left, and then here the left bit, that little landmass, like a kind of face sticking out next to the UK lettering, is Wales. So you can see that we're not very comparable in terms of size. Relatively small country, population of just over 3 million, and we have most people concentrated in the south with the capital city Cardiff and some other cities, lower numbers in the north, and then the middle is mostly kind of rural. There's some mountains, but we also have the Welsh language. Recent population survey estimates that 29.2% of people are able to speak Welsh, which is sort of just shy of 900,000 people. And I've been told by my boss not to mention the Rugby World Cup in this presentation, so I won't. Bit more context about kind of legislation. Legislation and policy affecting Wales is primarily carried out by the UK government and Parliament, but we also have the Welsh Parliament, the Senedd. Some matters are reserved for UK Parliament, welfare, defence, but the Welsh Senedd has the power to legislate on certain things, including housing, health, social care, education, and local government. The Welsh Government is committed to Housing First and is in the process of transforming the approach to homelessness in Wales to a kind of housing-led rapid rehousing approach, with Housing First being the most intensive part of that. And we're lucky enough to have strong cross-party support for the model in Wales as well. We use a modified, sorry for moving my face around so much. We use a modified set of Housing First principles in Wales, developed by a Housing First network, kind of community of good practice. The slight tweaks we've made to the kind of international set reflected sort of specific aspects of Welsh context at the time. So pretty high rough sleeping numbers, relatively old housing stock, particularly social housing stock, a desire to embed multi-agency working, and the progress we'd made in sort of trauma-informed, psychologically informed work. The principles are currently being reviewed. They're not going to change a huge amount. There are a few key changes. If anyone's interested in that work, please give me a shout. I could talk about these principles all day. There are 10 of them, and this is where I slip up and tend to waste a lot of time in presentations. So obviously get in touch with me if you need more details. I'm not going to go through all these. Here are the first three: right to a home, separation of housing and support. Target audience focus here is on rough sleeping, which is one of the main things we're changing in the review. Flexible support, not time limited. An active engagement approach to support. Individuals having choice and control. Focus on harm reduction. Housing First support being psychologically informed, trauma informed, and gender informed. And then the last two, strength-based focus on a person's goals and aspirations. Small caseload, we'll be moving that bit to the flexible support principle in the new ones. And then finally, a kind of multi-agency approach with the widest range of services possible involved in a service from the outset. So again, I've kind of rushed through those, but there we are. Okay, so the accreditation process. As far as I know, it was the first of its kind. It is still unique in the way it works. It's set up to ensure that services claiming to deliver Housing First in Wales do so in line with our principles, and that we have that fidelity to the model, that strong fidelity. We've awarded accreditation to 3 services so far. We have 3 ongoing, and obviously a waiting list of many more to follow. And the process itself is simple. I'm not going to be saying anything kind of controversial or strange, but it's a rigorous process, we hope. So here's a diagram outlining that. So after some initial conversations in this pre-stage and this sort of agreement with the support provider and their partners, we'll sign a commitments agreement that outlines what I expect and my colleagues expect from the service being accredited and vice versa. So things like staying in touch, responding to emails as promptly as possible, sending what we ask for, that kind of thing. And then the service will send coordinated, that's my old job title, will send us a load of documentation, policy documents, anonymized support plans, that kind of thing, service level agreements between different organizations, any document that could be relevant. We then plan a set of interviews and agree said plan and do it, carry the plan out. So that'll be interviews with support workers, managers, representatives of partner organizations like substance misuse teams, mental health teams, the clients themselves, probation workers, again, commissioners. So again, a kind of comprehensive list of people involved in delivering the service. This results in here we go, stage 2, recommendations report, which will have a series of recommendations that we talk through with the service, representatives of the service, make sure we're on the same page. There are no surprises in there. We kind of agree a time scale for either, that work to be carried out or started, depending on the recommendations and how kind of long or short term they are. After that time has passed and we kind of regroup and look at what's changed, I will draft a final report, which is shared with a panel of experts that we have, and based on my recommendation, the panel will then make the final decision based on that report. Those reports are available for the 3 we've done on our website. Again, if anyone has trouble finding them, just give me a shout. Just wanted to highlight some things from this process. Again, there's lots more I could say, but we want the widest possible range of stakeholders to interview. So I've already said, kind of from commissioners to support workers and clients themselves. Recommendations are carried out or work is begun according to a timescale that we agree together. I think that's really important, rather than kind of throwing a list at someone and kind of going, there you go, do that. We make sure we're in touch every step of the way. And some recommendations here in this last point are labeled critical. So that's where, we wouldn't award accreditation without evidence of progress or completion of those recommendations, as opposed to kind of best practice type recommendation. And there's usually a mixture of both in every accreditation process. Accreditation is awarded at the service level to all partners involved in delivering a Housing First service, rather than being awarded to organisations. So if an organisation, and this has happened, is delivering Housing First in different parts of Wales, we don't award to that organisation, we award to the service and their partners. What tends to happen, and what we hoped would happen and what has, is that a lot of good practice is then shared at organisation level, and it makes the subsequent accreditations easier. There is a subtle difference between assessing fidelity and quality. As a membership organisation, we're not necessarily want to be in the habit of assessing the quality of what our members do. Again, I could talk a lot more about that, but that is something that our Housing First network kind of talked through very carefully. In terms of what happens next, we are developing a kind of clearer set of minimum requirements for services to enter into the process of accreditation. We obviously have more and more Housing First services setting up in Wales, and we want to make sure everyone gets a consistent experience. In terms of that principal review I mentioned, we want to make sure that the new documentation around the new set of principles kind of aligns with the accreditation more coherently. The accreditation didn't exist when we first drew those principles up. So we're going to have, for example, with each principle, there will be a list of kind of types of evidence that would demonstrate delivery of that principle, just to make that accreditation, again, kind of easier, more consistent. And we're also then looking at kind of the reaccreditation process, what happens after a set number of years have passed, that kind of thing. And we've taken quite a lot of influence from what they do in Scotland with their sounding boards and a kind of more reflective approach. So we'll be working those ideas in future. And that's it. So my email address is there, alex@commonwealthcymru.org.uk. Any questions, I'm happy to take them. Move my face one last time so you can see me. Thanks so much for your time and attention and for reading my article and listening today. And enjoy the rest of the sessions. Thank you very much.
Sorry, just had to unmute myself. Thank you very much, everybody. It's so interesting, obviously, to hear what's going on in Canada, Ireland, and Wales. I think some of us are sitting here going, if only we could get that much government funding to be focused on housing first principles. I will also say, in terms of Stephen, yours was really interesting to look at the housing first principles in terms of how effective an intervention it's been in relation to young people. And I think that's something we certainly need to look to. And interesting to hear from Mark in Ireland, because that is really similar across the jurisdictions, where 77% of people are presenting across 4 or more of those domains. And it's just really a big indicator in terms of how much complexity there is when people are experiencing homelessness. So thanks for bringing that to our attention. We do have a couple of questions, so I do want to hand over, and I'll just read the first question that's come through, which was, it was announced that in Canada, Housing First does not provide wide-ranging and meaningful solutions for Indigenous peoples experiencing homelessness because it is misguided and there is no single solution. Because of intergenerational trauma and socioeconomic barriers, there must be solutions and supports available at multiple levels to ensure individuals receive the solutions needed for their particular situations. Has Housing First proved effective in any First Nations communities globally? And if so, where? And we're very lucky that Christian has volunteered to provide us with an answer to that one. Thanks, Christian.
Thanks for the question. I think that's a really relevant question. I think it goes back to the question around adaptation of Housing First principles. In general, the principles of giving people a choice about their housing and the supports they receive would work for First Nations people. But I think it's really crucial that the housing is appropriate, as well as the supports really address specific needs. And in the case with Noongar, it is around providing culturally specific supports and addressing and enabling recovery in a culturally healing pathway. So having supports directly in that way, that can mean co-designing with Indigenous people in Housing First programs as well. Ideally, support providers being in Australian contexts, archives. So I think that's a really critical point. To the initial question around what's happening in Canada, I obviously I'm not the expert in how it looks like in Canada, and I think that would be a really good question for Stephen to answer. I'm aware that in the evaluations of Just Via Time, looking into Indigenous perspectives has been one of the issues looked into. So there's a bit further reading, and I've provided a link to a quite interesting research article. But obviously, this is a huge fundamental question, and I don't think an easy answer either.
Thank you so much for that. Thank you so much for that, Christian. I also think that we can email Stephen to see what is going on in Canada and then share that with all the recipients. Is that correct, yes, I'm getting told that we can do that. So I think everyone would be interested in that one. We've got a couple more. Christian, obviously stay with us because I'm going to hand over another interesting question to you. But an easy one has come through around whether or not you'll have access to the slides in the recording. And the answer to that is yes, we will be making that available. So thanks for your interest. And we've got another question that's come through. Is there an accreditation model developed in Australia? Christian, are you able to help us with that one?
Unfortunately, not. Don't have any good answers around the accreditation process.
Yeah. So it's worth noting that in terms of accreditation, it works differently in different jurisdictions. I know in Victoria, the specialist homeless service providers have got a whole lot of accreditation, but we're undergoing so much review now with our social services regulations that we're in a state of flux in terms of the accreditation for service providers. But that one we will definitely take on notice because certainly the three international perspectives all mentioned accreditation and, well, not accreditation as such, but evaluation. So we can absolutely take that on notice. Thank you so much. I'm just checking if any other questions have come through. No, but we have shared some of the work that's going on in Western Australia, and I think that is worth looking at, and thanks to my superstars have put that in the chat, so that's great. So really, how about that? We really overestimated how many questions that we would get, so I'm going to give you an hour in your day that you never thought you had, so that's always a good thing. I'm normally finishing overtime, so I want someone to record this that I actually managed to finish not just on time, but to give people time. Thank you so much for your interest today and participation in the Housing First principles. It really does give me a whole sense of optimism about where this country's going in responding to homelessness. But I just want to finish by saying that this particular webinar with, I think we've got 70 or 80 people on the line now, would not have been possible without Andrew and Simon, who are the superstars who are sitting behind all of this and have managed to get the recordings internationally and get all of the subtitles up there. So I want to say thank you, a real testament to how the team at CHP work. Obviously, no Parity is possible without Noel. So thank you, Noel, for all the phone calls. And if you haven't been hit up for a donation, that time is coming because Noel makes those calls around the clock. So thank you. To all of our international participants, thank you for providing your expertise and knowledge to us in Australia. We're always ready to learn and be part of it. On that note, if I haven't finished anything, I think I can officially close the session, but I can't close it without the last plug for our CHP conference. We are under our expected amount of registrations. So if you are keen, sign up either to participate online or to participate in person the 20th and 21st of November. Check our socials. We want lots of people to be participating in that conference. Thank you, everyone. Happy Thursday and have a super weekend.